Hi, everyone, and welcome back to the Founders Series. I'm Dr. Rebecca Hertel, and today's episode is a special one because October is Menopause Awareness Month. So this is a time dedicated to breaking the silence around menopause, sharing knowledge, building awareness that can change lives for women everywhere. And on this show, we always weave together three threads. And it's the Founders Journal, your Midlife Minute, and In the Lab. And so today, each of these is going to center on menopause awareness and the unique perspective I have both as a physician and as the founder of a midlife focused practice. So in the Founders Journal, I'll take you behind the scenes into what has been one of the busiest months of my career thus far, my heaviest month of travel, speaking, and webinars, and I'll share what I'm reflecting on as a CEO stepping into my 10th month of business. 10 months, I cannot believe it, and preparing for the final quarter of the year. In the Midlife Minute, we'll dig into the heart of Menopause Awareness Month, what symptoms to look out for, and what to ask your doctor, and when to seek help. And my goal here is to give you practical, empowering knowledge you can use right away. And in the lab, I'll bust some of those common myths about menopause, using the latest statistics and evidence to set the record straight. So grab your coffee, take a walk, or just settle in. This is going to be an episode packed with reflection, education, and hopefully empowerment. So let's get started. So if I sound just a little tired today, that's because September and early October have been the heaviest months of my professional life to date. Back-to-back travel, events, webinars, speaking engagements. I've been living out of a suitcase and running on hotel coffee, which depending on the hotel isn't all that great. And catching up on patient notes at the airports, in the Ubers, wherever else. But I wouldn't trade it for anything. This month, I spoke at national conferences on midlife health and led webinars for healthcare providers on perimenopause treatment. And I sat on panels where the energy in the room was completely electric. There's something about being face-to-face with hundreds of women who are hungry for information that keeps me fueled even when my body is tired. But here's the part I want to let you in on. Being a founder, being a CEO, it's not just about showing up polished on stage. It's about managing the chaos behind the scenes too, because you have to still manage all that. So even though I'm traveling, I'm speaking, I'm in the airport, I legit was calling and making discovery calls at the same time in the car, in the airport. I'm calling them saying, oh, guess what? I have to be on. I'm in a whole different time change. Would you mind being flexible and changing your phone call? Can you get on now? So I'm still doing all of those things. I'm still answering phone calls. I'm still FaceTiming kids, so I'm still coordinating all those things, meetings, deadlines, keeping, this whole vision alive, even when you're pulled into 100 directions. So as I enter my 10th month of running osteopathic midlife health, I've been reflecting a lot on what it means to lead. So, this business is still very young, but it already feels like it has weight, momentum, and responsibility. There are days I wake up and think, how did we get here so quickly? And then there are days where the to-do list feels endless. That's been this week for sure, putting kids to bed. And I'm just like, when am I going to get to my to-do list? Because my day was already going. Then I'm doing mom stuff. And then in the evening is my work on business stuff. And so some nights you just don't get to that because family life they just need you and you have to be present for that. And so that's where you come to I wonder if I'm doing enough. So this season of travel tested me for sure. It tested my energy, my boundaries, my family rhythms, and my ability to stay grounded. There were mornings I had to remind myself to stop, to pause, to breathe, to take a deep breath, that you don't have to solve every problem before breakfast or before you work out. And there were nights when sitting in hotel rooms, you reflect on what it means to not just to build a practice, but to build a movement and building relationships, because all of the people that you're meeting, the friendships that you've had, and when you continue to see those friends again, you are strengthening those relationships and friendships. And that has been really a lot of fun for me. And I reflected a lot on that, just being able to take time to meet with people and spend some time with colleagues and friends that I hadn't been able to spend even just one-on-one time with. And so that's been really appreciative. So, we're not just talking about appointments and protocols. We're talking about changing the landscape of care for women in midlife. And that responsibility weighs very heavy. And it's also the reason I get up and keep going as well. So, as we head into the final quarter of the year, often I'll ask myself, what matters most? And for me, the answer is, clarity about what we're headed into year two, about the kind of team I want to build around me, and about what I need to sustain myself so that I don't burn out before this mission is accomplished. And that's really important to make sure that, burnout is so high. So, especially in midlife, especially in women, and especially in physicians. So, being a CEO is teaching me that leadership is less about sprinting and more about pacing. So, I have to take my own advice. When I talk to my patients, I look at them and I go, guess what? It's a marathon, not a sprint. And they're like, I knew you were going to say that to me. And this is true. It is a marathon, not a sprint. And I know I've said this before, you kind of want everything all at once, but that's just not reality. And it's also less about perfection and more about being persistent, and less about doing it all and more about doing the next right thing. So that's my journal entry for you today. Heaviest month, the most travel, the most speaking, and the deepest reflection yet on what it means to lead. So as we enter the last 90 days of the year, can't believe it. And FYI, I will be in summer mode until December 1st. So you can find me after that in winter mode. I'm carrying forward a commitment to strategy, sustainability, and service. And I encourage you, whether you're leading a business, a team, or a household, to take time this month to ask yourself what matters most for you as you finish out this year. So now let's shift into our midlife minutes, our practical, actionable education segment. And since it's Menopause Awareness Month, this one is especially important. So menopause is something every woman will go through if she's lucky to live long enough, and yet it remains one of the most under-discussed, under-researched, and misunderstood stages of life. So let's talk about it. So first, let's talk about the symptoms. When people think of menopause, the first word that comes to mind is hot flashes, but that's just one piece. Although we know up to 60, 70%, depending on the statistic that you read, of women do have hot flashes. It's not always the type of hot flashes that people look at or think of in the movies where, a woman's taking off all of her clothes. So here's what I want you to know, that menopause is systemic. It can affect, and pretty much does affect, every part of your body, from head all the way down to your toes. The vasomotor symptoms, which are your hot flashes and night sweats, they can be cold chills as well. Sleep disturbances, such as difficulty falling asleep, staying asleep, or waking up drenched in sweat. And sometimes it's just waking up being hot because the covers are off, they're on. So those changes in your hormones change your brain chemistry and disrupts your sleep. Cognitive changes, brain fog, memory lapses, trouble concentrating. Oftentimes women come to me more often because of the sleep and the cognitive changes. So those are very common things that we see, but maybe not so common when people think about menopause. Mood disruptions also. You can have worsening anxiety or new onset anxiety. Irritability, MenoRage, we like to call it, or just like the littlest thing sets you off. And then women oftentimes feel anxious and depressed because then they feel bad for losing it on their family and loved ones. And again, even just depression for women, just in really dark places, intrusive thoughts, oftentimes I will hear as well. The genitourinary syndrome of menopause, so vaginal dryness, pain with intimacy, increased urinary frequency, urgency, recurrent infections as well, or thinking that they have yeast infections, or recurrent UTI infections, but the cultures are negative. All of those come from the decreased estrogen and even testosterone around that genital urinary tract. And musculoskeletal, so joint stiffness, body aches. That's what they tell me. Like oftentimes they'll say, I get up off the couch and I feel like I'm 80 years old. So those types of complaints, the frozen shoulder, the hip pain, and then you also get an increased risk of bone loss. You get the most bone turnover in that late perimenopause to that early menopause transition, where your bone loss exceeds your bone building. And this is really important for women to remember because it's not symptomatic. And then your metabolic shifts. Metabolic shifts, you get shifts in weight distribution. So you have redistribution of adipose tissue or fat tissue to around what we call your visceral organs. So around your liver and heart. And that's the type, and it's inflammatory. We know that fat's inflammatory. And when that goes around the organs, then that is also puts you at risk for cardiovascular disease. It puts you at risk for type 2 diabetes and just a metabolic dysfunction, increase in cholesterol. And then you also get that stubborn minnow belly or belly fat that a lot of women get really frustrated with. So every woman's journey is very unique. Some will have mild symptoms, others can be debilitated, but awareness is the first step. And remember that every woman's menopause journey is their own and should not be compared to the next. So, what are the types of things that you should be asking your doctor? So, if you're walking into your doctor's office and saying, I just don't feel like myself, right? IDFLM, chances are that you are not going to get the help that you need. Because what does that even mean, right? If someone comes into me, if I were not in this space or before I was in this space, I would just be like, okay, do you have chest pain? Shortness of breath? Is it pain sharp? Dull? So, you know, the biggest thing is coming in there with a tool. So here's a script that you can take with you. You can say, can we talk about my menopause transition? Now, before you walk into your doctor's office saying that, that is what you need to make the appointment when you call the front desk. You need to make that appointment specifically for perimenopause or menopause symptoms and make sure that they will book you a proper amount of time, whatever is the longest that they will book you for. You're going to ask, what stage am I in and what should I expect? But perhaps before you do that, also, you want to make sure that this doctor that you're seeing or this practitioner that you're seeing understands perimenopause and menopause. So even in that first visit, you can talk to them about all of the things that are going on. And then you can ask the question, do you treat perimenopause and menopause? And if you don't, do you know where I can find a practitioner? And that's okay because your doctor probably doesn't know. And that's just the way it is. I'm hoping that will change. It will change. I'm positive about that. But at this point, it's make sure that you call, make the appointment for appropriate amount of time about your perimenopause or menopause. And then when you get in there, you can give them all the information and then ask if they treat that. If they do, then you can ask what treatment options are available to me, including hormonal therapy, non-hormonal, and then lifestyle strategies. The next thing you can ask is, can we evaluate my risks for cardiovascular disease, osteoporosis, and metabolic syndrome? And in all honesty, those things should be already in place if you're seeing your practitioner regularly every 6 months, once a year, whatever that is. The next thing that you can ask for are what labs or screenings would be appropriate right now. So those are important. So at least you're going to be looking at like an A1C, a lipid, a CMP. I like vitamin D. I like fasting insulin. There's a lot of other more in-depth lab work that you can get, making sure too, if you're in menopause, are you due for your colonoscopy? Are you due for your pap smear? Are you due for your mammogram? These are all screenings, right? These are cancer screenings. Are you up to date with all the immunizations that you should be having as well? Are you up to date with getting a bone density? And you all know how I feel about bone density. I think every woman, at least age 50, should get it. So there are lots of diagnoses that practitioners can use in order to get it covered. And if it's not covered, out of pocket, at least the local out of pocket expense is $100. So it's worth that. And the reason I say that, and I just said this yesterday, I said, I know it's $100 and that can be steep, but do you know how expensive it is to break your hip? So, or break a bone. It's going to be more than $100, girlfriend. I just want women to like think about that. And so, but again, there's some diagnoses. So let your practitioner at least try to put some diagnoses in: high risk for osteoporosis, menopause syndrome, ovarian failure, if family history of osteoporosis. You can be on high risk medications, especially if you're on proton pump inhibitors, things like that, things that already decrease your bone density. So there's ways around that. And then if not, save up, get it done. It's important. Third, when to seek help. So the short answer is don't wait until it's unbearable. If symptoms are interfering with your sleep, your work, your relationships, or your quality of life, it's time to ask for help. And if your doctor dismisses you, it's okay to find another provider who listens. You deserve care that honors this stage of life and does not minimize it. Menopause is not the end of the story. With the right knowledge and the right support, it can be a beginning of a stronger, more vibrant chapter. All right, and now let's step into the lab where we cut through the noise and look at the facts. And today we're busting some of the most common myths about menopause. Myth number 1, menopause only lasts a year. I love it. The reality is the menopause transition, called perimenopause, can last anywhere from 4 to 8 years. And these symptoms can continue even after your final period. Remember that menopause is 12 months and 1 day, or it really is 1 day after 12 months of having no period. And so everything after that is menopause. You're in menopause forever, forever. Some call it postmenopausal. It is menopausal. Menopausal, postmenopausal. It's all really the same thing. So studies show that more than 80% of women experience symptoms, and for some, they last a decade or more. There are some women still in their 70s that complain of hot flashes. So myth number 2, hormone therapy is unsafe for everyone. The reality, this myth took hold after the Women's Health Initiative study in the early 2000s, which was widely misinterpreted. We know, that study has been walked back. Updated research shows that for women under 60 or within 10 years of menopause. Now, I like the 10 years of menopause because in all honesty, if a woman is 56 and stops her period, then that 10 years means that she can be 66. Within that 10 years, she's still going to get the most bang for her buck if she starts menopausal hormone therapy within that time. So under 60, we don't use as much. Really, it's just that 10 years from menopause. I like to use that more because I think, again, you're giving women like 5 years. And if some of our, late menopausal women in late menopause is age 56, they still have quite a bit of time. Hormone therapy is both safe and effective with benefits that outweigh the risks for most women. This is absolutely true. Most women, the benefits outweigh the risks. Myth number 3, weight gain is inevitable. So in reality, menopause does shift metabolism and fat distribution, especially toward the midsection. But let me be clear, aging shifts metabolism and fat distribution as well because we lose muscle mass as we age, men and women, all human species. We lose muscle mass and that gets replaced with fat tissue. And muscle is more metabolically active at rest than fat tissue is. So the studies show that lifestyle, strength training, you all know if you follow me at all, strength training is huge. Balanced nutrition and stress management, sleep management can dramatically reduce or even reverse these changes. Now, it will slow down that muscle loss. As of now, the studies show that it will still occur as a part of aging, but the more you strength train, prioritize protein, sleep, stress reduction, you can minimize the rate at which that occurs. So it's not destiny, it's physiologic plus your choices. Lifestyle is huge, you guys. You don't get out of it without work. Myth number 4, nothing can be done about menopause symptoms. Reality, this is perhaps the most damaging myth of all. Research shows that 75% of women who seek help never receive treatment. This is true. Women will go through 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 visits before they finally find someone to help them. Despite the fact that effective therapies exist. You guys, hormone therapy is FDA approved for vasomotor symptoms, hot flashes and night sweats, and the genitourinary syndrome in menopause, and the prevention of osteoporosis. Right there. This is a failure of the healthcare system, not a reflection of reality. So here's the takeaway. Menopause is real, it's complex, but it is manageable and treatable. The more we replace myths with facts, the more we empower women to thrive in this stage of life. So that's today's episode of the Founder Series. We reflected on what it means to lead during the busiest month of my career. We walked through the key symptoms and questions for Menopause Awareness Month. And we set the record straight on myths that need to be retired once and for all. So if this resonated with you, share it with a friend, a sister, a colleague, a spouse. Remember, our men need to know too. So if you have a male spouse, share this with them as well. Every conversation we have moves the needle on awareness and advocacy. And if you're looking for more support, resources, or way to connect, check the show notes. I've linked some helpful guides and communities there. So as we close, I want you to remember, menopause is not an ending, it's a transition. And with the right knowledge, it can be a season of incredible strength, clarity, and renewal. I'm Dr. Rebecca Hertel, and this has been the Founder Series. So until next time, take care of yourself and take care of each other.